Regina Kenner and Pamela Burton are dedicated registered nurses, specially trained and experienced in cancer care at the Regional Cancer Center at Stafford Hospital, where they offer a special cancer nurse navigator program. Regina and Pamela are here to tell us more about their program. We were just talking about that a moment ago, that you are navigators for a patient and their family when they're going through one of the most difficult times of their lives. Explain to us what this program is all about.
So a navigator, a nurse navigator with Mary Washington Healthcare Regional Cancer Center at Stafford Hospital, we basically try to make sure that a patient from the time of diagnosis all the way through survivorship has the real benefit of an advocate. So that is what the navigators do. We make sure that there's no barrier to care. Whatever that barrier might be. It might be something as simple as transportation, but it could be something as complicated as finances. Education is a huge part of what we do. Cancer care in today's world is quite complicated. We have wonderful technologies that can be very confusing and daunting to patients, so we try to overcome that with our education. Cancer now can be, we can identify certain molecular structures like in the genetic makeup of a cancer cell. Sometimes there's a mutation or a defect in that genetic component. And we can look now at different therapies that are quite different from the standard chemotherapy and radiation. So that can oftentimes lead us into that different area of treatment. So helping the patient understand all of that after they get over the shock of their diagnosis is a big part of what we do.
Pamela, give us an example of a cancer patient's journey.
So what I do as the breast health navigator is most of my patients I meet the day they're told that they have breast cancer. So I meet them that day. We'll go over as much of the technical details that they want to hear, that they're prepared to hear at that time, provide a ton of emotional support. But at that initial meeting, I am getting them an appointment for the next step. So when they leave, they already know, okay, so I know my diagnosis and I know where I'm going next. So we will follow them through their whole journey. They have our contact information to call as often as they have questions. I tell patients, if you call me every day, that's not too much. They're not allowed to be at home worried about something that we could very easily help them understand. And their journey can be, surgery, chemo, radiation. So we have a lot of therapies that help them along their journey with like massages and Reiki and a registered dietitian that is specific to meet with them and to help them with their specific issues.
We talked a little bit about the barriers in the beginning, but what are some of those other barriers that patients face when they're going through treatment?
So occasionally it can be something that just requires a supportive resource. Patients will lose their hair sometimes with the chemotherapy, so we make sure that we have resources for them for image enhancement, makeup and wigs if need be. So we have that. Reconstructive surgery in many areas of cancer, not just breast cancer, but let's say in a patient that has melanoma, maybe they've had a disfigurement in their, or a skin flap or something that needs to be fixed. Or certainly we have many patients with head and neck cancer. It's a very common cancer right now that we see a lot of at Stafford Hospital. And we want to make sure that that those rehabilitative services, we have specially trained rehabilitation therapists at the hospital that are specially trained in cancer rehab. So.
And I imagine education is a big part of this all, educating the families on the treatments that are available.
Right. So we have every week, multiple days of the week, we have multidisciplinary cancer conferences where all of the physicians that are involved in the patient's care, the surgeons, the pathologists, the radiologists, the medical oncologists, everybody's there talking about the latest treatments that are available for patients that are presented at the conference. So that's one of the main ways that me and Regina stay educated on the latest and greatest in treatment options for patients.
Well, you guys were saying you both are good friends and you've worked together for a long time, and you've seen a lot of very sad stories, but you've also seen a lot of inspirational stories as well. But you're the people that kind of guide these families through such difficult times.
We hope that we put that human compassion back in it. It's a big technical world of cancer.
Yeah.
So giving the human component back, the compassionate component back, if we've done that, we've done our job.
Well, thank you for your great work that you do and continue to do, and educating us all about this program as well.
Great.
Great to meet both of you.
Thank you for having us.
Thank you.
All right, we're going to have more of Let's Talk Live coming up right after the break, so stay with us.